We've talked about receptor affinities and signaling and peer-reviewed data, and we're avoiding the fact that this chemical, this compound, is being used in a sacramental context. And does that have anything to do with its use for addiction? Should we ignore that? Should we ignore that in view of the fact that most of our patients interpret their recovery in terms of a transition or a spiritual transformation? We avoid this G word, the God word. We're secular, we're clinicians. We're not supposed to go there. That's some kind of a subjective state. But our patients go there more often than not. This is the center panel from the triptych Rise and Fall of Addiction. This is based, I've been told, on the image of Shiva. Here, Shiva is dancing. His right foot is on the god of ignorance and loss of truth. And here we have the foot on the dope god. Shiva, with his right foot, crushes Asparmara, the dwarf of ignorance and forgetfulness of the truth, or maybe perhaps the dope god in the other image. Shiva represents the power of destruction of the old, but the old has to be destroyed to give rise to the new. He is seen by his followers as the Lord of creation. So that's one branch of Hinduism. That's their take on it. And then another branch that gave rise to Buddhism, the ascetic or renunciation branch, would talk about intention versus obsession, attachment, the loss of delusion as a cardinal spiritual goal, which is also a goal of the pharmacological treatment of addiction. And if we want to go Old Testament, we can talk about the Exodus. We can talk about the flight from Egypt, Mitzrayim, which is in Hebrew means a narrow place. Addiction is surely a narrow place. And this being a Christian country, we want to end on the note that this woman may be also saying, "In you he has risen."